So if you're going to have a mole taken out, let's say this is your mole on your skin, usually what we do is we take a couple of millimetres on either side, and then we take what we call an ellipse out. Now there's a variety of different things that we can do in different places, but this is the commonest way of taking out a mole. So we tend to make it about 2.5 to 3 times the width that's here, so that it means that when it is taken out it gives us a nice line. So you'll end up with a scar that is about this long and have stitches in that. When we start off, we put an injection at either end, so here's a little needle and you get an injection into each end and to the whole area to make it numb. It takes a little while to make it numb, so we give you a bit of time after we've done it, not because we're messing around, just to let the stuff go numb so that you don't feel any pain. And we do test it before we start cutting. When we take it out, we take quite a deep part underneath. So if we look at this now, this is where we've taken it out of your skin here, and there's your mole sitting on there, and we take a piece that means that we've got quite a deep layer underneath as well, so we know that we've got a margin on either side and that we've got a margin quite deep down as well. And then we'll take that out and send it off to the laboratory. The risks of having surgery are a few things, and you need to get followed up if there's any concerns about your wound, but the things that can happen is that you can get an infection. So what happens with an infection is often you'll have your wound with your stitches in, and you may have stitches that stick out, you might have stitches that just run along without knots in them, and you'll get a red area that will come around this wound, and in fact it may get mucky in between. So if anything like that happens, then you need to go back and see your doctor or their nurse. The other thing that can happen with any wound after surgery is that it can bleed. So if you've got a wound that, let's do one so you can see what other stitching sequences look like. You can get something that may look like this, and you might get some bleeding that comes in drops of blood that comes from here, and it will continue to ooze. So the thing about that is that pressure is quite useful, and if you put pressure on it for 10 minutes and watch the clock, then that will help. But if it's continuing to bleed over a few days or bleeding lots, then you need to go back and see someone to make sure that things settle down. The other thing is that sometimes we don't get the whole thing out. So if it's a mole and we can see it and it's nice and clear, it's quite easy to say we've taken 2 millimetres around it and we know that we've got the whole thing out. If it's a slightly red coloured or paler lesion that we're removing, it's sometimes not so easy to see where the edge ends. So you may have a lesion that's like this, that's actually quite a pale, ratty sort of looking thing, and it might be really close to one of these margins, so that when the laboratory has a look at it, they go, well, we can't tell whether that actually extends a little bit out into the other side. So sometimes we need to come back and do some more surgery and remove a little bit more. And the third thing that can, the fourth thing that can happen is that occasionally, if it is something that's nasty, so we took out a mole that was a little bit miscoloured or those sorts of things, and we took the 2 millimetre margin and we knew that was fine. Some lesions that we take out need more to be taken out later on, because we know that if it's going to spread and it's a nasty spreading type lesion that's been removed, then it will spread in the local skin. So if I'd taken out a lesion like this, and we know that that mole was sitting in the middle of here when we started, and we discovered that it was a lesion that needed some more taken out, usually what we do is we measure from the scar out the distance that we need to take out, and then we take out some more skin around that. Now, depending on where the sin is will determine how much we can take out, but also how easy it is and the method we use to take that out. But that would be discussed with you prior to the next lot of surgery if that was what was required.